Hello and welcome to another episode of BioNexus Health Podcast Series. Today we'll be speaking to Emily from New York. Emily is only 20, but she's been through a lot with Lyme disease, co-infections, mold exposure, and failure to get better with regular treatment. And she found her way to naturopathic herbal treatments. So we will speak with Emily and talk to her about her journey and how she has fared with completely plant-based, all natural herbal treatment so far. So let's welcome Emily to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie Dashore.
So hi, Emily. Welcome to today's podcast. How are you?
I'm good. Thank you.
Good, good. So I'm so glad you're here because, someone who is only around 20 years of age, it's very surprising that there are so many youngsters, young men and women like yourself that are going through severe Lyme disease, co-infections, mold illness. Can you tell us a little bit about your journey from the beginning? Where was the tick bite? How did you know you had Lyme? And then I believe you actually treated with antibiotics for a long time, for about 1.5 years.
Yeah.
Go ahead.
So it starts in the 7th grade. I'm outside my backyard and I have a tick like right here on my chest, and I run into my inside and I'm like, Dad, I have a tick, like freaking out, can you take it off? And so I get a tick. I guess I get a little sick, and we go to the doctor, and they're like, hey, you have Lyme disease. Here's antibiotics. You'll be on it for 6 to 8 weeks. I don't really remember specifically how long. It was doxycycline, and that was it. I didn't think much about Lyme disease after that. So then for the next following couple of years, I started having a bunch of weird symptoms out of nowhere. Fatigue, just declining health in general. My knees hurt really bad that I wasn't even able to walk. In the 8th grade, I went to the ER because it was so bad, and I was a dancer, so I thought maybe I got injured or something, or I fell, or I landed on my leg weird, and I went to the ER, and they gave me a cast and crutches. And
so wait. So sorry. So I'm going to be interrupting you so that we get the full picture. So you went to the ER because you had knee pain.
Yes, and it was
that bad. Okay.
Yeah, and it was just very strange and out of nowhere. So it seemed like I got injured somehow, but they did x-rays, CAT scans, whatever. They didn't find anything. They're like, maybe you have a little tear in your muscle, but they didn't really do any extensive testing or anything after that. So they just gave me a cast and crutches, and I was in a wheelchair for a couple of weeks, and I was able to just start to walk it off and get used to having pain in my knee. It would come and go every once in a while, but it did eventually kind of get better, but it would flare up from time to time, as did other joint pains. My back would hurt. My aunt used to tell me that I used to always carry ibuprofen around with me because I would always be in some sort of weird pain. And I don't even remember that I did that, but it's because I didn't know that I was having these chronic symptoms that just weren't going away. A lot of cognitive issues. I was always very smart, and things came very easily to me for school. And throughout high school and as I was getting older, it just wasn't coming as easy to me anymore. And I started getting really bad panic attacks, anxiety, mood swings. 1 minute I would be happy, and then the next minute I would feel this rage of anger or sadness. I would be I would go to stand up, and it would feel like I'm gonna pass out. Just
Oh, right, right.
Wild range of random
Symptoms, right? Yeah. So you had POTS like issues as well, right? Stand up and you would have vertigo.
yeah.
Okay. Now your initial treatment was just the 6 weeks of doxy.
Yes.
That was it. You were not treated for co-infections, or there was no repair which was done with the damage caused by Lyme. I see. Okay. So this was seventh grade and you are now in high school and you're suffering cognitively as well as physically.
Yeah. I would sleep all day. I wouldn't want to go to school. I always felt sick. My head would hurt. I had really bad insomnia, like night terrors, all of this crazy stuff. I started going to therapists, psychiatrists, other types of doctors to figure out what was going on with me. I was told I'm just a girl, that I'm going through puberty.
Oh,
Uh, maybe my period is about to come. Everything. I was like, I don't know.
yeah.
And I was like given like antidepressants, anti-anxiety medications. I
Oh,
didn't.
sorry, you were actually given the
Yeah.
okay. And
I
you
was given
were on
Adderall.
the medications. Okay,
Yeah.
right.
I
Okay,
just was prescribed all of these things, and it just, it was for the symptoms, but it wasn't this big picture. Like there was something more that was wrong, but no one was
right,
like diving deeper into like, oh hey, like also all this other crazy stuff is happening to this girl. Like maybe it's a bigger picture. Maybe there's something
right.
else wrong.
Yeah, maybe it's
Um,
not just the hormones, just because she happens to be a girl. Yeah,
yeah,
unfortunately, that happens to women of all ages. Sometimes women do it to themselves. We do it to ourselves. Or maybe, it's just like it's the cycle, it's the hormonal issue, it's just
right.
stress. Maybe I'm doing too much, but because what happens is overall on the outside, you're managing, you're strong, you're
Yeah,
doing okay overall, and it becomes difficult for people to realize what's going on within, and it's taking every ounce of your strength to kind of keep it together.
right. And like, how am I supposed to know, as someone who's not a doctor or a trained medical professional, that all of these things are coming from Lyme disease or some sort of like vector-borne illness? Like, I don't know like how all of that stuff works. So I put that trust into these doctors to tell me, hey, this is what's wrong with you. And when that's not being figured out, it's really scary because everything progressively just got really bad, where my
Mhm.
mom was like, enough is enough. And she asked every single person, hey, have you heard of like these symptoms happening to like young adults or girls or anything, like just people around her school and stuff. And eventually she was like, hey, let's see if you have Lyme disease. Someone told me that they had similar symptoms to you. I went to an infectious disease doctor when I was 17, and I did a blood test for Lyme and it came up positive. Well,
Mm.
actually, no, the blood test didn't come up positive. They did like a DNA test, I think it was.
Oh, I did the DNA
Yeah.
test for you,
Yes,
right?
you did that too. And then, but I think they did one too that just told me that
Okay,
I had Lyme, but it wasn't the co-infections.
I see.
I
Okay.
think originally they said that I didn't have it, but then he was like, you may have chronic Lyme. And that's when they
Mhm.
tested me with the DNA. And then I also did one with you for the co-infections as well.
Okay.
Because I remember I tested negative with the blood test. And I think that happens very frequently with Lyme disease patients. So then he recommended me to a doctor um, who specifies with Lyme disease. And I did antibiotics for a year and a half. I had a PICC line towards the end of it, and just it helped me a lot and got me really far, but it also feel like caused a lot more damage at the end of the day. I just felt like my body couldn't fight off any like bacterial infections. I kept getting strep throat, um, just a bunch of things. Like I just kept getting sick all the time. And then I found you. And now this is where we are.
So after about 1.5 years of PICC line antibiotics, you actually found your immune system got weaker, you were sick, you had strep throat. I believe you also mentioned multiple UTIs
Yep.
as well.
Yeah.
Okay.
It was like clockwork.
Oh, goodness. Okay. So how did you guys, I know your mom is also highly educated. She's a teacher. So how did you guys decide to let go of conventional and then, just go with completely herbal plant-based?
Honestly, I just did a bunch of research like online, like going through like different Lyme forums, like through Reddit and Facebook and talking to other people who had Lyme disease, and they all recommended going the herbal route and trying to heal your body, not just with medicine, but also with like lifestyle changes,
Mhm.
like being gluten-free, eating organic, healing yourself with a diet that is more plant-based, and just being more aware of the things that I'm putting into my body. Also like meditation, yoga, exercise that I was capable of doing at the time. I can't run a mile probably, but I don't know, just stuff like that.
Good.
And overall lifestyle and holistic route. And I did a bunch of research on different doctors and stuff like that online, and getting recommendations from other people on these forums, and which led me here. I guess I felt that the Western world of medicine kind of failed me. I think that it helped me get to a better place, the antibiotics, but I just didn't want to do that forever.
Right.
I got a lot of side effects. The PICC line was horrible. When I would administer the medicine to myself, it felt like ants were like crawling through my body.
Right.
And it was just a really terrible experience, honestly, especially towards the end. So changing up the way that I wanted to heal myself, I guess, yeah, let me hear.
Mm-hmm. So let's talk about starting an herbal protocol, right? There were a few things that we had to investigate for you. Many times what I've observed is people who don't get completely better from Lyme disease, they have other things going on, like maybe there's mold, maybe there's biotoxin illness. So we explored that for you as well, right? We looked at co-infections this time to see what needed to be treated. So there's Lyme co-infections. We looked at mold, MARCoNS with the sinuses. Do you remember what the tests came back as?
Yes, so we had Babesia came up, Bartonella, and then I had that chronic sinus infection that was antibiotic resistant to like 6 different antibiotics, which was crazy. I didn't even know that like I had a sinus, like I didn't even know that like that, I don't know, like I didn't, like I find it amazing that like there's just so many other things that like I wasn't tested for when we found out that I had Lyme, like chronic Lyme later in life, that there were all these other things too. So yeah, I think that was all the stuff that we found.
That's good, because many times people do not get tested for the 6 antibiotic resistant MARCoNS, that is the mold associated MARCoNS that happen to people, which gives them sinus infections. And it's not necessarily an infection, it is more like a colonization, which causes a lot of brain fog symptoms.
Yeah,
I
have brain fog all the time. Like not as much anymore, but like throughout my life, like sometimes it just feels like there's like a brick wall like in front of like my brain, and it's just like won't let me like just, I don't know, focus.
Right?
And
Yeah.
I don't know.
Your house where you were brought up was from the 70s. So we kind of explored, we made sure that you're in a safe environment.
Yeah.
Right. And were you, I met you, I think, right before the first COVID lockdown.
Yes.
Right before. And then since then, what has your progress? I mean, the first time I met you, you were in pretty bad shape. You were trying to be brave, but you had so many symptoms. You were, barely functioning at college. You were not living up to your potential. Quality of life was poor. Your mom was like super worried about you as well. So since then, right, can you talk about your protocol? And that, we also realized that you had multiple sensitivities, so we had to go slow with you. You managed really well with building up your herbals slowly. So
Yeah.
right, can you tell me a little bit about what was your experience with your herbal protocol, and little by little what symptoms got better?
Okay, yeah. So when I first met, wait, what, were you gonna say something?
No.
Oh, okay, sorry. When I first met you, I definitely my cognitive standpoint was not good at all. I really struggled with like depression, anxiety, panic attacks, um, all in like that mental world, I guess. And then physically, I just like felt like I couldn't go about my day at all. Like I could barely work at that point. I was a server, and standing up for like long periods of time, I just wasn't able to do it. I slept all the time, and I just had to always rest my body. It's just very frustrating. I love hiking and being outdoors and being able to do all active, fun stuff outside, and I just was not able to do it. Um, I just felt like my brain wasn't mine anymore, and I would like literally look into a mirror and just not be able to recognize myself. It was really scary. Um, and I did have a really bad reaction with, as I mentioned before, with my PICC line, which I guess maybe like I'm a little bit more sensitive to some medications, and because I had so many things going on, and I've had Lyme for such a long period of time, that I don't know, I guess when you start taking the medicine and it starts breaking up and you start releasing it, it just is a lot. So I started, when I started the herbs, I took everything very slow. I would take like 1 or 2 drops of everything a day. And then like each week I would say, hey, I'm going to add 1 or 2 more. And with like taking vitamins and like vitamin C, magnesium, the iodine. There's so many.
Yes, probiotics, right? Probiotics, you were doing those as well, like gut support, organ support, of course. Yes, it gets very complex.
Like the liver support and all that stuff. I think like a big part of what helped me a lot was that we were also supporting like my body, instead of just fighting off the Lyme, that it was also like, hey, like let's also focus on like building up your immune system, and doing like the liver support, all the organ support stuff. Like I had not done any of that before, or even really thought about it. And then also adding in focusing on my diet and eating gluten-free helped me tremendously with the process of like healing myself with the herbs. I think that's about it. And now I'm here, and I'm able to build up everything to what we wanted to get it to. And I've been feeling pretty good with it. Every time I try something new, build it up slowly again, but still.
So yes. So I've noticed, tremendous improvement in you to back to being the old Emily prior to all of this, right? So you've had improvements with your mood.
Yeah.
Can you tell us a bit more about your mood, your cognitive function? You also did the Formula 1 nasal spray for MARCoNS, right? Yes. Right. So aches and pains, joint pains, fatigue, brain fog, mood. Can you tell us a little bit more? Your UTIs, your gut?
Yeah. So I guess I'll start with like the mood and all that stuff. I never want to experience a panic attack again because I think they're one of the scariest things ever. Um, and I don't think I will, but because of just where I am now. But I was experiencing panic attacks like crazy. I would get them all the time. I have not experienced one in a very long time. So I guess that was like one thing. And then with the anxiety, the mood swings, I have definitely been able to just move on from that as well. Um, like it's been doing pretty good with that. And then
Your sinus issues are all gone, sinus problems, sleep issues.
yeah, sleep issues. I've been able to sleep a lot better. Sometimes I do still experience insomnia from time to time, but I don't know if that's just sometimes I'm excited about the next day or not. Like if I have something going on, but that's been doing pretty good too. I'm able to hike and go outside and experience life the way that I wanted to, which has been great. Sometimes I do have to take things a little bit more slow than other people and maybe pay attention to some things a little bit more like, oh, am I staying hydrated? Am I treating my body the
Yes.
way, I don't know, just be on top of things a little bit more, like lifestyle wise. Sinuses have definitely been better. My voice used to be like super nasally and like I feel like I can like hear my voice like a little bit better, like the way that it is supposed to be. So that's really nice. Um, my memory seems to be coming back a little bit too. I was definitely struggling with like memory loss and just I would wake up one day and be like, what did I do yesterday? I don't really remember. Like, um, so I've been able to like get that back too, which has been nice.
That's awesome to hear. Your mom and dad must be so relieved as well.
Yeah, I think that everyone's been really happy about like my
Mm,
progress. Still a journey to go, but I think
yeah.
that I'm closer to a finish line than I have been before,
Yes.
which is nice.
Well, it's so lovely to see you
Yeah.
and to hear about your success and the fact that your quality of life is improving day by day.
Yeah.
Um, what is your college status? Aren't you going back to school now?
Yeah. I'm actually my my schedule for next semester is calculus, chem, and physics. And I
Wow.
don't think I would have been able to do that a couple of years ago. Which is crazy. I'm able to go to school and know that I'm able to accomplish something because for so long I just didn't even want to go to school because I felt so sick like all throughout high school and I just felt so down on myself because it made me feel stupid. Like I was like my cognitive ability all of a sudden was just gone. I wasn't able to read. Like I would look at a page and like I would be able to read it, but it just like wouldn't set in my brain.
Mm.
So being able to say that I'm about to take calculus and chem and physics is a really big deal to me. And it's really nice that I'm able to do that. And I'm proud of myself.
And I'm proud of you as well. Yes, absolutely. It's not an easy protocol, but if you stick with it, go step by step, then you will I've heard patients say that they experience a deep healing which lasts. It's not your fly by night symptom relief. It is right, with herbs we go deep inside
Yeah.
and we heal from within, and that's the same journey I took myself when I was healing myself from Lyme and mold and biotoxin illness. But I'm really happy that you decided to share your story. I'm sure it's going to help many that are that will be tuning in. This is not live; it's a recording, but many people will watch your story and be get hope, be inspired. Understand that there is light at the end of the tunnel.
Yeah. For all those people out there who feel lost, you will find your way. because it is a scary world out there, and a lot of people don't understand chronic Lyme. And so like I just know that like explaining it to people is also very difficult, because it's hard to explain to someone like what Lyme disease is, because everyone knows what Lyme disease is, but they don't know like chronic Lyme
Right.
and all that stuff. So you're not alone.
Right. Also with the mold and the MARCoNS, with the multiple antibiotic resistant, it's just the awareness is slowly increasing.
Yeah.
But it's not fully there yet. Right.
Yeah.
So that is our podcast for today. I am grateful to Emily for joining us today and speaking to us about her journey with Lyme disease and mold biotoxin illness. Thank you so very much, Emily, for being here today. And thank you also to those who have tuned in today for this podcast. I hope to see you on the next episode of the BioNexus Health Podcast.
Thank you for joining
Namaste.
Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.